Hi everyone, welcome back to our video series. My name is Courtney Cook. I'm a licensed board certified genetic counselor and I'm the founder of Cook Genetics Assessment and Testing, which is located in Effingham, Illinois. This video series we're really talking about who should have genetic counseling, who should have genetic testing, why is this something that you should be interested in? And since at Cook Genetics we do try to focus on cancer predispositions, we're making some videos to talk about different cancers that might be in you or in your family and whether this is something that applies to you that you should have genetic testing and genetic counseling for. So we've done, previously we've done breast cancer videos, ovarian cancer, and colorectal cancer. So this video is going to focus on uterine cancer. Uterine cancer, also known as endometrial cancer or cancer of the womb. So we'll use those terms kind of interchangeably here. If we say uterine cancer, we also mean endometrial cancer, womb cancer. This is not the same thing as cervical cancer, that's a different cancer. So if you've got an actual uterine or endometrial cancer in your family, then this video is for you. So we're going to talk about the reasons that somebody might meet criteria for testing based around uterine cancer. And then at the end, we'll talk about our contact information and where to go from there. So let's get started. So our first indication is if a woman has had uterine cancer at age 49 or younger. That's kind of our home run. So if you've been diagnosed with a uterine cancer and you are 49 years old or below, then you can meet criteria for genetic testing. If it's 50 or up, that doesn't count, but we'll start talking about some other indications as well, so maybe you might fall into some of those. So 49 or younger, there we go. We recommend genetic counseling and genetic testing. Now our second indication is if you yourself have had a uterine cancer and then you've had another Lynch syndrome associated cancer yourself. So a lot of genetic testing for uterine cancer surrounds something that we call Lynch syndrome. So Lynch syndrome is a genetic condition that we test for, and it can increase the risk of a lot of different cancers, mostly GI cancers, maybe some brain tumors in there as well, skin cancers. So we'll go through this list of Lynch syndrome tumors, and then we can kind of combine here. So our Lynch syndrome cancers, we'll list them. The first one, colon cancer, then uterine cancer, ovarian cancer, stomach cancer, pancreatic cancer, bladder cancer, biliary tract cancer, urothelial cell cancer, small intestine cancer, brain cancer, usually glioblastoma, and then sebaceous cell adenomas or carcinomas. So your sebaceous cell is basically these glands in your skin that produce oils. So if somebody has had a sebaceous cell carcinoma, then they have had cancer of that oil gland in the skin. So all those cancers I just listed are associated with Lynch syndrome. So for our second criteria here, if you are a woman who has been diagnosed with uterine cancer at any age, and then you had another Lynch syndrome associated cancer, any of those I just listed, then that would be a reason for you to have genetic counseling and genetic testing. Now our third criteria here is if you are a woman who has had uterine cancer yourself, and then you have had a first-degree relative or a second-degree relative who has also had a Lynch syndrome associated cancer under the age of 50, so age 49 or younger. So you have had uterine cancer yourself, and then maybe your father had colon cancer at age 35. So it doesn't matter how old you were with your uterine cancer, but you had that relative who was at least 49 or younger whenever they had their Lynch-associated cancer, then we think that you guys should have some genetic counseling and genetic testing. Now our next criteria would be if a woman has had uterine cancer herself, and then she's got 2 first-degree relatives or second-degree relatives on the same side of the family that have had Lynch-associated cancers, no matter how old they were. So this is a good time to remind people who our first-degree relatives and second-degree relatives are. So your first-degree relatives are your parents, siblings, and children. Your second-degree relatives are one step beyond that. So grandparents, aunts and uncles, nieces and nephews, grandkids, those are all your second-degree relatives. So if we are worried about having multiple of these cancers in our family, then these people all need to be blood related to each other. So they all need to be on the same side of the family. So again, that last criteria was you're a woman with uterine cancer, and then 2 people on the same side of your family have had Lynch syndrome associated cancers. So an example of this would be you have uterine cancer at age 60, and on your mother's side of the family, maybe an uncle had a bladder cancer and your niece had a colon cancer. So we've got 3 people on the same side of the family that have all had Lynch-associated cancers. Okay. Now let's get into our family history combination. So maybe you yourself have not ever had a uterine cancer. However, you have had a first-degree relative who has had a uterine cancer. So maybe you are a 30-year-old female and you've never had uterine cancer yourself, but maybe mom had uterine cancer whenever she was young. Maybe she was like 35 and she passed away from it. Then that would be a good reason for you to get genetic testing. So no uterine cancer in you, but you've got a first-degree relative who had uterine cancer under age 50. I don't know if I said that the first time. So age 49 or younger, that first-degree relative has to have been diagnosed younger with that uterine cancer. Our next criteria here is you have not had uterine cancer yourself, but you've had a first-degree relative who has had 2 different types of Lynch syndrome associated cancers. So you've not had cancer, but maybe your sister had uterine cancer and a bladder cancer. So that's one person that's had 2 different Lynch syndrome associated cancers. So we would still want to test that sister first, but maybe, she passed away or she's not interested in testing. It's still a good idea for you to come have genetic counseling and possibly genetic testing. Our next criteria here is if you have not had uterine cancer yourself, but you've got 2 first-degree relatives or second-degree relatives on the same side of the family that have had Lynch syndrome associated cancers, but one of them had to have been diagnosed at age 49 or younger. So you've not had any sort of uterine cancer, but maybe on your mom's side of the family, maybe your mom had a bladder cancer and your aunt on your mom's side had a uterine cancer at age 46. So one of them was diagnosed under the age of 49 or younger, and there were 2 Lynch-associated cancers in close relatives on the same side of the family. If they're not interested in genetic testing, then you would be the next person in line to consider having some genetic counseling and possibly genetic testing there. Now our next criteria, you've not had uterine cancer yourself, but you've got 3 relatives on the same side of the family that have all had Lynch syndrome associated cancers. So maybe on dad's side of the family, dad had colon cancer, his brother had bladder cancer, and your aunt on that side had uterine cancer. So we've got 3 different cancers on that same side of the family that have all been associated with Lynch syndrome. Doesn't matter how old they were, we just had to have 3 of them. So there's another reason if those people are no longer living, if it's still something that you're concerned about because you've got multiple Lynch syndrome associated cancers on one side of the family, then you can absolutely have some genetic counseling and genetic testing. Now, going back to things that we've talked about before, so there are some tests that look at more of the pathology of the cancer itself. So what that cancer looks like under the microscope. So there are some reasons that somebody with a uterine cancer, maybe their cancer looks a little bit different under the microscope than we would imagine, and maybe the doctor is a little suspicious of Lynch syndrome, then that would be a reason for you to get referred to genetics to talk about maybe doing some genetic testing to see if you do have this condition. Or if you've been diagnosed with a uterine cancer and it was a more advanced stage and your doctor decided to do tumor genomics profiling on it, so basically seeing if there are targeted chemotherapies that your doctor can use to treat you based on the genetics of your tumor. If something has popped up on that your doctor is a little suspicious of, they can always refer you to us to see if that was something that you were born with or if it was something that just happened to pop up in your tumor. So a lot of that gets more complicated. We really recommend talking with your doctor about that sort of testing. If you've had any sort of genomic testing on your tumor and you're wondering if this is something that you should be tested for as far as genetic testing goes, you can absolutely reach out to us and ask us. Otherwise, talk to your doctor and see if that's something that they would be concerned about. We don't want to use our family members' tumor testings to consider genetic testing for an unaffected person. So if you've not had cancer yourself, but maybe recently your mom was diagnosed with a uterine cancer and she had some tumor testing, we don't want to test you based on mom's tumor. We would rather test mom first. Those tumor tests are pretty specific to that person, so we don't really base family history stuff on tumor testing. But there are plenty of other ways to meet criteria based on your family, like we already talked about. So if there's anything that you've been concerned about based on your personal history of uterine cancer, or lots of uterine cancer in your family, or lots of these Lynch syndrome associated cancers in your family, more than welcome to reach out to us. You can book appointments online on our website. We also have a lot of frequently asked questions on our website and more information about genetics, genetic testing, genetic counseling. So go ahead and visit our website. It's www.cookgenetics.com. And of course, you can reach out to us with any questions. You can find us on Facebook, Twitter, Instagram, or you can email us. Our email address is courtneycook@cookgenetics.com. And we look forward to hearing from you and seeing you soon.